Dr. Mansoor, the president of Academy of Family Physicians. If I'm forgetting any prominent individual, just forgive me. In the United States, they say old age does not come with kindness. I'm very thankful to Dr. Farhan and Dr. Rabia making my task easy. Ladies and gentlemen, like 25 years ago, as Dr. Farhan mentioned, we used to dismiss this fatty liver. When I see young doctors in the audience, when I was in my training phase, fatty liver, it's all dead. A week ago, I saw a patient, a good friend and a colleague, mother. She is in late 70s. And first thing she had was hepatocellular carcinoma. The lady was bit obese and diabetic. She does not have hepatitis B and C. It was shock for the family, for me, and for the patient. So this is a new potential volcano we are sitting. Ladies and gentlemen, world population is around 8 billion plus. And among those 8 billions, if we conservative estimate, 25% have MASLD, metabolic dysfunction-associated liver disease. So it means 2 billion people are sitting for a recipe for a disaster. Among those 2 billion, by conservative estimate, 20% already has stage 3 or stage 5 fibrosis. So this is not something trivial. Metabolic dysfunction, liver disease has superseded hepatitis B, C, as Rabia already mentioned, alcohol in all parts of the world. So we should be taking it very diligently, differently, and seriously. What I'm going to do with you is this afternoon, I just wish to revisit just for a brief second that what is this new term, and it's an umbrella term, and under this term comes this guy is sharp, इकबाल का फरमान है एहसास मुलावरत को कुचल देते हैं हालात मेरी जनरेशन के लोगों को अब डिफिकल्टीज हो रही हैं to so many things. So this is in metabolic dysfunction associated with liver disease. So basically what it is, steatotic liver disease, metabolic, which has been discussed in great detail, and then comes alcohol, and then this cryptogenic drug abuse deal. And just concentrate for a second on this. जरा तस्वर मोटे होने के नाल शराब का भी एलिमेंट है. You have been dealing with these patients. Alcohol, liver disease, and metabolic dysfunction live together. A person who is obese, who is diabetic, he may or she may be consuming alcohol. So this is a new category we should keep in mind. MASLD and alcohol, उसमें predominant क्या है? But we need to understand that stock was changed कि non-alcoholic कि भाई वो बीमारी नहीं है जिसका नाम लिए जा रहे हैं. So this is the reason it was changed. But still, we should keep in hand that alcoholic liver disease exists and they coexist together. This is just something for us to keep in hand. So this was Dr. Ravia's last slide and what to do with these individuals. Basically, as has been said by previous two distinguished speakers, it's a metabolic syndrome display in the liver. So what we have: lifestyle, weight loss, cardiovascular, diabetes. If you have low risk individual, and how you establish, to my simple mind, in Pakistani perspective, you only need 2 3 tests. You're sitting in your office, you need a CDC. If your basic platelets are 130,000 and below, this is not a good thing. You need LFTs, ideally ALD, if it's 50 and 60. If you have a capacity to calculate FIB4, FIB4 is very simple. Age, AST, platelets, these things, it's an app thing calculator. And if your FIB4 is 1.3 and below, platelets is 130,000 and up, ALD is 40, 50, and of course you had an ultrasound. This is low risk individual. You can sit on him, educate him, hey buddy, you need to be careful, cut down carbohydrates, fats, have some protein, exercise. If he or she is hypertensive, treat them for blood pressure and diabetes. The next category is intermediate risk. And again, very simple. If your platelets are 120, 110, FIB4 is 1.3 and above, or 2 and above. This is the individual who is sitting on difficult scenario. So they need intervention. Other than diet, other than your blood pressure pill, other than diabetes, they need some specific liver-related treatment. In high risk, Dr. Rabia showed fibroscan. It's a new gadget. जिस तरह एंडोस्कोपी डिस्क्रिमिनेटली हम यूज कर रहे हैं ना, पर्दा फटे हम क्या आ रहे इसी तरह फाइब्रोस्कैन भी. Fibroscan is not for advanced liver disease. If your patient has decompensating cirrhosis, guys, belly is bulging, he is throwing up blood or having melena, and again I have seen reports they need to do fibroscan. So fibroscan is for a moderate disease, not for guy with ascites and bellies. So high risk individuals are who have decompensated cirrhosis. Of course, we deal with them, but topic of the day is something which I will allude to in a few seconds. हमारे इन audience में, including myself, I think we qualify 30% of us are easily in NAFLD category. So, energy deficit. I'm very simple, irritated vegetarian guy. उनके यहाँ 500 कैलोरीज काट कर दो है डॉक्टर फरहान. तो जो भी खा रहे हैं थोड़ा सा कम करें. आप स्लाइडें दिखा रहे थे दोनों,